Hello, Robert Bastian here. In my introductory video on my integrative diagnostic model, I explained that there are three parts, and I talked about there being both necessary. You can't leave any of these three apart, but they are also sufficient. If you use these three, you don't need anything else. But I didn't get to the idea of integration. The idea is of triangulation. So just let me show you a little summary here. So the integrative model is what the person tells you in the history, what the voice tells you via vocal capability interaction, and more to come on that later, and what the larynx tells you with a really high quality examination. So once you get those three pieces of information, then the three things should all line up on the same diagnosis. This is not what you get. Let's say you have a singer who has so far undiagnosed nodules. If you take an obtuse history, you may say, well, this must be inflammatory, I guess it's reflux. If you don't interact with the voice and the patient's speaking voice sounds quite normal, then you will overlook the idea that they have a vibration-induced injury. And if your examination is far and fuzzy, so what instead you want is the focused history. The person talks about themselves as being highly social and talkative and so forth. So that says, maybe vibration injury. Vocal capability battery, we do the little tiny happy birthday test, which I've made a whole video on vocal cord swelling checks. And that you learn that even though the speaking voice is perfectly normal sounding, there is real impairment of the upper voice. And so that says, okay, this makes sense. Overdoer profile, over sociable and talkative, and we have our positive swelling checks. And then you do a very intense examination, including at high pitch. And there you see these little margin elevations. So that's the idea of triangulation using the integrative model. It's not this. Because you don't do a good history or don't know how to do the vocal capability battery and your examination is subpar, but it's instead this. Once you get those three arrows going to the same place, it's a powerful diagnosis. And then you'd say, what would be the point of doing more measures, objective measures and so forth, because I have this nailed. So that's the idea. Integrative diagnostic model, three parts, both necessary and sufficient, and then you triangulate. And I'm always concerned about the person out there who says, well, this sounds complicated. It's really not complicated. It's very straightforward. So if you'll just let me press on and help explain further how to work this model, I think you'll find that it really turns some lights on. So thank you for listening.